Hello, dear friends. Today, I want to talk with you about chia seeds, a product that has become extraordinarily popular in recent years. They're often called a superfood, attributed with almost magical properties. But are chia seeds really as beneficial as claimed, especially for older adults? And why is there so little discussion about the potential risks? Throughout my years in medical practice, I've encountered situations where people, striving to eat healthily, became enthusiastic about trendy products. Sometimes, unfortunately, this led to health problems. Chia seeds can also prove to be less harmless than they appear at first glance. Therefore, today I'll tell you the complete truth about this product, calmly, without advertising hype or myths. What are chia seeds, and why is there so much talk about them? Chia seeds are tiny black or light gray grains obtained from the Spanish sage plant. They were first used in ancient times in Central American countries. Now chia seeds can be found in health food stores and even on the shelves of regular supermarkets. They are indeed rich in nutrients. Let's look at their composition. About 34% fats, with a significant portion being omega-3 fatty acids, approximately 19% protein, about 34% carbohydrates, most of which is fiber, high calcium content, over 600 milligrams per 100 grams, magnesium and phosphorus, important trace elements for bones, heart, and nervous system. At first glance, an almost perfect product, especially for those who care about joints, digestion, and cholesterol levels. But as often happens, not everything is so simple, especially if you're over 50. Real benefits of chia seeds for older adults. Let's honestly examine how chia seeds can truly benefit older adults. After 50, it's especially important to care for bone strength. With age, and particularly during menopause, women face an increased risk of developing osteoporosis. Chia seeds contain calcium in a form that's well absorbed by the body. Just 2 tablespoons contain about 180 milligrams of calcium, nearly 1/5 of an adult's daily requirement. Additionally, chia contains magnesium and phosphorus. These substances work together, helping maintain bone tissue density. Studies show that regular, moderate consumption of chia can support bone health. But it's important to remember, one product alone won't solve all problems. For real benefit, vitamin D and physical activity are also necessary, at least light exercise or regular walks. Heart and vascular support. Chia seeds contain plant-based omega-3 fatty acids, particularly alpha-linolenic acid, or ALA. For older adults, this is important. Omega-3s help reduce bad cholesterol levels and support vascular health. However, there's a nuance worth knowing. Plant-based omega-3s aren't absorbed as efficiently as those found in fish, such as mackerel, herring, or salmon. The body can convert only 5 to 10% of the plant form into active substances necessary for heart health. Therefore, chia seeds are a good supplement, but not a replacement for complete omega-3 sources, like fish oil or ocean fish. Digestive regulation. Many older adults face constipation problems. This is related to both metabolic changes and dietary patterns. Chia seeds are rich in soluble fiber, which swells in the stomach and forms a soft gel. This improves food passage through the intestines and can ease bowel movements. But this is precisely where the first serious danger lies, which is rarely mentioned. Hidden dangers, what doctors don't always discuss. Like any product, chia seeds have not only advantages, but also risks, especially for older adults. Some of these can be quite serious if you don't know the important nuances. Risk of intestinal obstruction. In 2014, medical journals described cases where elderly patients were hospitalized with signs of intestinal obstruction. The cause was chia seeds consumed in dry form. Why does this happen? Chia can absorb 12 to 15 times their weight in water. If eaten dry without sufficient liquid, the seeds begin swelling directly in the esophagus or stomach. This can form a dense gel-like mass that blocks food passage. This is especially dangerous for people who already have slowed digestion, quite common with age, experience difficulty swallowing, take medications that slow stomach and intestinal function. Impact on medication effectiveness. Chia seeds are high in fiber and fatty acids, which also require caution. They can affect the absorption and action of certain medications, particularly blood-thinning agents such as warfarin or aspirin, blood pressure medications, blood sugar regulating drugs. How does this work? Fiber can slow tablet absorption, while omega-3 fatty acids can enhance the effects of blood-thinning medications. This can lead to unwanted consequences, especially if you're taking multiple medications simultaneously. Kidney strain. Another important point is the possible strain on kidneys. Chia seeds contain considerable protein, phosphorus, and potassium. For a healthy person, this might be a plus. But if you have chronic kidney disease or are undergoing kidney-related treatment, excessive consumption of these substances can be harmful. The body may simply not cope with their elimination, creating additional strain and increasing complication risks. Who should avoid chia seeds? Despite their popularity, chia seeds aren't suitable for everyone. There are situations when it's better to avoid them entirely. Chia seeds are categorically not recommended for acute stomach or intestinal conditions, such as gastritis, peptic ulcers, colitis, diverticulitis, inflammatory bowel disease, severe kidney failure, seed allergies, especially if there's been a previous reaction to sesame or mustard, plants from the same family. Use with caution and only after consulting a doctor for taking blood-thinning medications, such as aspirin or its analogs, low blood pressure, hypotension, diabetes, especially with sharp blood sugar fluctuations, irritable bowel syndrome, when digestion is already sensitive and reactive to fiber. Common myths about chia seeds. Let's examine the 3 most common myths associated with these magical seeds. Myth 1. Chia helps you lose weight quickly. Reality. No product can burn fat by itself. To lose weight, you need a reasonable caloric deficit and physical activity. Yes, due to high fiber content, chia seeds can temporarily reduce appetite, but they're quite caloric, nearly 500 kilocalories per 100 grams, so in large quantities, they might even hinder weight loss. Myth 2. Chia cleanses the body of toxins. This is a common misconception. Our body already excellently cleanses itself through the liver, kidneys, skin, and breathing. No product, including chia seeds, can replace these organs' work. Extracting toxins is more of an advertising slogan than reality. Myth 3. Chia is the best source of omega-3. Yes, they do contain omega-3 fatty acids, but of plant origin, and they're absorbed less efficiently than those found in ocean fish. To get the necessary amount of beneficial substances, an adult would need to consume about 100 grams of chia daily. That's nearly 500 kilocalories and far from a safe fiber dose. How to properly consume chia seeds after 50. If you've decided to include chia seeds in your diet, it's important to do so wisely and with understanding of mature body characteristics. Here are recommendations based on scientific data and medical practice. Seed preparation. Never consume chia seeds dry. Always pre-soak them. This is necessary for your safety. Simply cover them with water for at least 20 to 30 minutes, but preferably leave overnight. Optimal ratio, 1 tablespoon of seeds to 100 milliliters liquid. water, milk, or kefir. This creates a soft, gel-like consistency that's easily absorbed and doesn't traumatize the digestive tract. Safe amounts. Older adults should start with a small dose, about 1 teaspoon per day. If the body responds calmly, the dose can gradually increase to 1 to 2 tablespoons daily. This is sufficient to obtain 5 to 10 grams of fiber, 2 to 4 grams of protein, 90 to 180 milligrams of calcium, 1 to 2 grams of omega-3 fatty acids. These amounts already provide beneficial effects without creating unnecessary strain on the gastrointestinal tract. Best timing. Optimal consumption is in the morning or first half of the day. The fiber in chia can slow digestion, which might affect sleep quality if consumed in the evening. The combinations? Chia seeds pair well with natural yogurt, if no stomach problems, preferably not on an empty stomach. Fruit or vegetable smoothies, porridges such as oatmeal, buckwheat, or rice, homemade desserts such as milk-based puddings. What to avoid? Don't consume chia dry. This can be dangerous. Don't combine with other laxative products such as prunes or flax seeds if you have sensitive digestion. Avoid taking before bedtime, possible heaviness and bloating. Healthy alternatives to chia seeds. If chia seeds don't suit you due to health conditions or personal sensations, don't worry. There are many other products that provide the same beneficial substances in more familiar and gentle forms. For bone health support, sesame seeds, especially as tahini paste, rich in calcium, magnesium, and other substances necessary for bone strength. Sardines with bones, one of the best sources of easily absorbed calcium and vitamin D. Green leafy vegetables, such as broccoli, spinach, cabbage, parsley, they help slow bone mass loss. For omega-3 fatty acids, fatty fish, such as mackerel, herring, salmon, sardines, the most effective omega-3 source, especially important for heart and vessels. Flaxseed oil, plant alternative that can be added to cold dishes. Walnuts contain beneficial fats and antioxidants. Quality pharmaceutical supplements with EPA and DHA, especially if fish is rarely in the diet. For good digestion and fiber, oatmeal gently cleanses intestines and suitable for daily breakfast. Bran, oat or wheat, well regulate bowel movements and improve microflora. Psyllium, gentle plant fiber source, often used for sensitive intestines. Fresh vegetables and fruits, essential diet components, especially for maintaining intestinal health without medications. If you maintain diverse, balanced nutrition, trendy products like chia aren't necessarily required. Health isn't about exotic foods. It's about regularity, moderation, and attention to your own body. Final recommendations. If you decide to try including chia seeds in your diet, start with the most important thing. Talk to your doctor. This is especially important if you have chronic conditions, take medications, or experience digestion or swallowing difficulties. Even if you feel well, reasonable caution never hurts. Don't rush. Start with literally a quarter teaspoon per day. Observe your body's reaction, calmly, without expectations. If everything goes well, you can gradually increase the portion over time. Don't forget about water. This is very important. Chia seeds absorb liquid, and if there's insufficient fluid, unpleasant sensations may occur. It's best to follow each spoonful of seeds with a full glass of water, or add them to dishes that already contain liquid. And of course, listen to yourself. If you notice bloating, stomach pain, difficulty swallowing, or any unusual reactions, stop. Sometimes even the most beneficial products don't suit you personally. This is normal. When choosing chia seeds, pay attention to simple but important details. They should be dry, odorless, without foreign impurities. It's good if the package closes tightly or has a ziplock. This helps preserve freshness. The expiration date should not exceed 2 years, and after opening, it's best to store seeds in the refrigerator and use within 6 months. Moisture is unacceptable. It quickly spoils the product. Simple recipes. Chia seeds can be used in various ways, but it's especially convenient to include them in familiar, gentle digestive dishes. For example, a simple breakfast pudding. Soak 2 tablespoons of seeds in a glass of plant milk. Oat or coconut works well. Add a little honey and a pinch of cinnamon. Leave in the refrigerator overnight. And in the morning, add pieces of soft fruits like banana or peach. This is a gentle, satisfying, and healthy breakfast. For something refreshing, prepare a light drink. Add a spoon of soaked chia seeds to a glass of warm water. Add some lemon juice and a teaspoon of honey. This drink can be taken half an hour before meals. It gently tones and aids digestion. In conclusion, chia seeds are neither a miracle nor a panacea, but used wisely, they can indeed become a useful addition to the diet after 50. The main thing is to approach this consciously. Consider your body's individual characteristics, consult with doctors, don't rush, and don't overdo it. Remember, any dietary changes, especially in mature age, require attention. Health isn't the result of one product, however trendy, but a whole system. This includes nutrition, movement, and regular medical observation. Chia seeds can take their worthy place in the diet, but not as a foundation, but as one detail of an overall reasonable picture. Treat yourself with care and always choose what suits you personally.
Thank you for being with me today. Thank you for your attention, for your kindness and participation. You are a valuable part of our friendly community. See you soon. Take care of yourself and be healthy.